I'll give the an update on what changes were made to the CCC website guidance documents for patients. And these were decided over the past week by the Taskforce. And if you go to the COVID-19 website, crohnsandcolitiscanada.ca/COVID-19, under guidance, there is now a new section, and that is what if you test positive for COVID-19? And if you click on there, there's going to be information on what to do if you end up being diagnosed and testing positive for COVID-19. So I'll switch over to the slideshow now and actually just switch this around. Give me a second. There we go. So you should all be able to see this slideshow. I'm just double checking that, and yes, indeed you can. So here's some information really about what happens if you test positive for COVID-19. What should you do? And remember that all of these recommendations are based on the latest available evidence that we have. It's changing rapidly, and so these recommendations may change in the next few weeks. They're not permanent. So don't necessarily, if you're watching this 3 weeks later, you want to go to the website and make sure that it's still the same. We also make these recommendations based on being extra cautious and trying to protect patients. So they may not be, we'd rather err on the side of caution than err on the side of opening things up and allowing people to do more things. And so bear that in mind as well. And then finally, I'm going to repeat this over and over, especially in this part, but none of these recommendations should replace the recommendations of your local public health agency or your doctor. So please speak to your doctor before moving on any of these recommendations. So what should you do if you test positive for COVID-19? These are recommendations specifically with a positive viral test, and that in Canada means a nasal swab for PCR for the virus. These are not recommendations if you get an antibody test, an immunity test, and that's positive. That's a whole different thing. And we know from the media all the problems with these antibody tests. We're not sure what these antibody tests mean, and we're now just testing a bunch and they're going through studies. So really what we're talking about is you've gone to a testing center or to a lab or to a hospital and you've had a nasal swab and you've tested positive. And that's just to reemphasize again that if you get symptoms of COVID-19 and you've not yet been tested, you should go to the COVID-19 self-assessment tool. And that's the Canadian link for the self-assessment tool. There are specific assessments for each province, and go through the self-assessment tool. It'll tell you whether or not you should get tested, and it'll tell you where to go to get tested in your region. So if you test positive, the first thing to do is speak to your gastroenterologist as soon as possible, please. Your gastroenterologist will walk you through what they decide is the best thing for you and discuss that with you in terms of weighing your risks and your benefits for medications and treatments. And also remain isolated. So speak to your local public health unit. They would likely have been the ones to call you and tell you you tested positive, so they'll give you instructions, but you want to stay away from other people if you test positive. If you're not on an immunosuppressive medicine, and the non-immunosuppressive medicines are shown below, then continue your medications. Do not stop them. There's no evidence that any of these medicines or the enteral nutrition or probiotics are associated with having worse COVID-19. So just keep going on that. You want to treat your IBD as best as possible. If you're on immunosuppressive medicines, the recommendations are slightly different, and these include biologics. So all the immunosuppressive medicines are listed here. You'll be able to see the list on our website as well. The first thing to do is call your doctor immediately, but stop your medicines temporarily. Okay, so hopefully you'll be able to get a hold of your doctor or the clinic or your nurse fairly quickly. But if, for example, it's a Friday afternoon, the office is closed and you realize you test positive, you will want to stop your immunosuppressive medicines temporarily unless you're on steroids, unless you're on prednisone. Never stop prednisone suddenly. Please stay on it and wait for your gastroenterologist to call you back. We're not sure whether it's safe to continue or not continue the other immunosuppressive medicines like the biologics and azathioprine and methotrexate. So speak to your doctor. Your doctor will sit with you and kind of balance the risks and the benefits of continuing these medicines when you have active COVID-19 infection. And that may depend on various factors like whether you're at risk for serious bad outcomes from COVID-19, with your age, which obviously puts you, if you're older age, puts you at increased risk of problems, as well as how active your inflammatory bowel disease is, or how risky it is to stop your medications. In general, if you've stopped your medications, it should be safe to resume your medications approximately 2 weeks after you've started having symptoms. You should be recovering by then. So if you've started mostly recovering, if you've mostly recovered from COVID-19 symptoms, you can start your medications again about 2 weeks later. A little bit of extra information. Some mild symptoms may last longer than 2 weeks, so don't panic. Things like post-viral coughs and the lack of ability of taste and smell can continue beyond the 2-week period. Speak to your gastroenterologist, but it's likely safe to continue to restart your medications, your immunosuppressive medications, even if you have some mild symptoms like that. Again, your doctor may counter all of these and say, no, it's more important that you resume your medications because your IBD is active and we don't want you to flare up and get really sick, even if you have COVID-19 infection. General guidelines, if your symptoms of COVID-19 are lasting longer than 7-14 days, it's probably a good idea to speak to a physician about that and make sure everything is okay, especially if the symptoms are getting worse around the day 5 to 10 period, which is the time that people start to get more sick with COVID-19. And then finally, remind your doctor, if you don't mind, I think it's an important effort that if you test positive for COVID-19 and you have IBD, you can be registered in the Secure IBD research registry or the disease registry. Your doctor has to do that, has to fill out all the information. So please remind your doctor to fill out that information at covidibd.org. And as usual, remember that what we know about COVID-19 and how it acts in people with IBD is changing pretty rapidly, and these recommendations should supplement but not replace the recommendations of your public health unit and of your physician.